Hi, welcome to KraftiMama.com. I'm Elsie van der Kolf, and this is Corrie van der Kolf from Extreme Gymnasium here with me. Today we're going to talk a bit about getting back that tummy after you had your amazing little baby. And Corrie is going to help us a bit with that. Because one thing I've found is that what us mummies tend to do is we just jump right into exercising, and we tend to damage some muscles and things like that. Corey, what can we do to correct that?
Well, one of the first things, if we actually look at the natural processes or going back a little bit in time with the natural processes, in history we found that women after childbirth spend quite a bit of time still at home, even in bed, which allowed the body to start recovering better after pregnancy. Now, it was not just because they were tired and worn out. It was basically for the pelvis to settle back into its position and the ligaments to start shortening again. So where today we have a cesarean or we have a childbirth, and immediately after that everybody wants to go on with life as normal.
Yeah.
And that actually abrupts or stops the process of the body actually restoring to its normal capacity. So ideally, it is recommendable that women after childbirth actually take a couple of weeks just to settle in with baby, back at home, get back to life, but not outside life, inside life.
Yeah, I think it's life in general at the moment. It's as if we tend to rush everything. We have to get back to work, get back to doing things. We tend to forget about the natural side of life and take some time, heal properly. Yeah.
Well, I remember from the notes that we were going to look a little bit at postnatal depression. And that's one of the elements where, with the modern lifestyle, we want to be feeling exactly as we did before the pregnancy straight away. And we consider postnatal depression, or even depression as in general, as a negative. Where in reality, when you actually have a postnatal depression after your child has been born, it's a very normal and natural process where the body really starts mourning for what it has lost. Yes, it's gained something, but it also lost the independence of not having something to carry around permanently. It lost the social interaction for a period of time. Your life will never be the same again, which means your body has to go through that process, and we then actually think, no, I shouldn't feel like this, I must just go on. You're supposed to actually go through that process of mourning to a point where you can actually take on life again as normal.
So we're actually saying is that it's a natural process,
It
and
is.
we must embrace that and accept it and work through it instead of just saying, I have a big problem now, I'm into depression and I have to, it's natural and it's fine, and just work through it.
Yeah, but what we maybe can say in that sense is instead of trying to take the depression away, make sure that you actually get enough support from around you to actually be able to go through the process. Like in any situation of mourning, you actually need time, and you need time with support to assist you through that process. So whether it's going to be through your spouse or through your family or through friends, but make sure that you actually make sure that that net of support is there when you're in that difficult place. Being able to talk, being able to express, obviously rest also plays a major role there.
Now, say for instance, we do want to do some exercises to get back that pre-pregnancy body. We've talked a bit about this before, and it all comes down to core and strengthening the core before you actually just go right into exercising and damage muscles. How do we go about doing that, Corey, to strengthen the core?
Yeah, the Pilates way is obviously the one I'll be expressing the strongest on. Core stability Pilates way is not about tummy muscles or back muscles or pelvic floor muscles or diaphragm muscles. It is an integration of all the systems in the human body, which basically means you've got to learn to move again or start moving again. So when we're in pregnancy, to a huge degree, your movements becomes inhibited. So when you then start moving again, you're not comfortable moving. You actually have to relearn to move from scratch again. The nice thing with Pilates is we work in a way where the pelvis is nicely supported, we do the flat back or the imprint Pilates method, which means that the pelvis is placed in a position where there's no strain on the actual deeper hip flexors, which strains onto the lower back. All goes onto the actual rectus abdominis, the six pack. Now, this already is kind of a nice integration, because most ladies after pregnancy, especially with natural childbirth, suffers from problems like a bit of leaking, those kind of areas in the pelvic floor, and you could be spending years and a lot of time and money on rehabilitating those muscles without having any success. The pelvic floor is a subconscious reactor. It's not a muscle that you can exercise to actually kick in consciously, or you can train it, but it won't actually then do the job under normal circumstances. So when I started doing Pilates, we were trained as well that we should use the Kegel exercises, etc. And after a couple of months of training, people would say, but why isn't this getting better? So we started looking a little bit deeper into this. And at that point, going back to the original Pilates program, we actually found that when you actually exercise the rectus abdominis, I'm going to interrupt myself slightly there. All the exercise for the Pilates program is aimed to restore firing patterns in the body. So when I want to pick up a cup, I don't think to myself, okay, lift the shoulder, then throw the arm up to get the coffee to my mouth. I actually just lift the cup, and it naturally kicks in the right muscles in the right
muscle
sequence.
memory.
Yes. Now, when that has been abrupted through an injury or childbirth or any of those things, that pattern has to be restored. And the natural firing pattern for the pelvic floor is rectus abdominis, the six-pack. That fires automatically into the transverse abdominis, which is like the weightlifting belt around the waist, and that naturally fires the pelvic floor. So by literally bringing the rectus abdominis, the six-pack, back into action, you actually restore your pelvic floor muscles. So, and with that, immediately the whole core area is activated naturally. So that's a nice way, or easy way to actually bring that back into balance.
Okay, right. So basically, there's not really a lot of exercises any of us can sort of do at home to get any of that back. The best would be to go to a Pilates instructor and...
It would be best for the start out, especially because with the pregnancy we lose awareness of where we are. I quite often explain by saying, if you would take your arm out sideways and I ask you to take your arm out sideways and you do it, you would find that the arm is in an awkward angle, not straight out, because we don't have perception of where the arm is in space and time. So with the body as well, that's something we need to actually restore. So going to the Pilates instructor, they become your awareness for the first couple of sessions until you feel confident again to actually move without actually taking your body into potential injury.
All right. So if we do want to go to a Pilates instructor, there's a few things we have to look out for. As I've heard before, that you can go to the right one or you can go to the wrong one. I mean, we don't want to step on any toes, but what do we have to look out for to make sure we don't end up in a pitfall of going to the wrong instructor?
First thing is the instructor, if they even give you the option to do a group class from the start, you know it's the wrong instructor. That means the person has got no idea of actually looking at postural correction, because you can't do that in a group. Secondly, I would ask the person a little bit about their background, if they, what kind of people they work with, what kind of time frame they actually spend in their studies. You get people that go for a weekend course and they become instructors. Our instructors go through a 3-year training period, during which we actually take them for all the different facets of anatomy, physiology, psychology, etc., to actually give them a broader aspect or broader understanding of what they're actually physically going to be working with.
Yes. There's a philosophy about the body, mind and spirit and how it all gets connected to each other. And I know you've got a special bond with that philosophy. Tell us a bit about that. I mean, when you want to fix your body that you had before pregnancy, some of us think you can just go exercise or whatever. And how do we get all that connected?
We look at the body through as you just said, the connection of emotional, physical, and spiritual. When I say to you, your mind stores information, for me, the body stores emotion. So when I look at the human body, I don't just look at aches and pains just as aches and pains on face value. I actually try to see deeper than that. So, for instance, if somebody comes in and they've got quads that continuously overworks the upper leg muscles, they actually almost hurt when they do exercises. The quads represent anger. So then I know I've got to actually go and dig into a little bit deeper on an emotional level to find out why anger would be overloading in the body, because that causes postural deformities or postural compensations, which all links together to actually put the body then into a place where it doesn't actually restore normally. So every part of the body actually has an emotional connection as well as a physical connection. And then if I take it even deeper than that, then I quite often say to people that what we experience on a spiritual level displays itself on the physical level. So for me, when I look at the body, I literally try to see the person on a spiritual, physical, and emotional level at the same time, and try to guide all three of those elements in the right direction.
So there you have it, ladies. Strengthen that core, body, spirit, and mind connected. Stay in touch for more from motherandmakingnaturally.com. Thank you, Corey.
Thank you very much. Appreciate it.